from the station that's on your side. This is Channel 7 News Daybreak.
6:23 is our time. Welcome back into Daybreak. Joining us this morning for Wellness Wednesday, Baptist Health Dr. David Gerson with Sherwood Family Medical Center, discussing some ways we can all be a bit healthier this spring season. Dr. Gerson, good morning to you. Thanks for joining us.
Yeah, made it to the big table.
What do we? I know. Congratulations on the promotion. What do we always ask when you come in? You don't have to reveal too much, but every break you come in, we always typically say, "Hey, Doc, what are you seeing around the office?" We always want to know, what are you seeing around the office right now? And that's, I think, a good idea just to update people as we kind of get into a period where COVID cases are rising a little bit. We understand the flu is still going around. What are you seeing around the office that maybe people should be aware of?
That's it. That's what we're seeing.
That's it? That no big deal?
No,
Just a couple COVID, couple flu?
Yeah. You know, it's May, and so people think we're done with flus and colds and COVID, and we're not. We're seeing tons of it. Even at 95 degrees, we're seeing these respiratory illnesses come in. We had a little GI stuff come in a few weeks ago. It would last 2 or 3 days, but people got over it. Stay hydrated and stay home, most importantly.
Right.
But right now we're seeing where these allergies are just so bad. People are having sinus congestion for so long. Kind of acts as a pool and makes you a little bit immunosuppressed, makes you just a setup for getting these infections. So we're seeing sinus infections, bronchitis, sore throats, but again, probably 95% of them are viral. And so what we're asking people to do is, if you're sick and you're tolerating fluids and you're surviving, stay home, don't go to work. But that's what we're saying, and it's still here. And so we want patients to make sure they're taking care of their allergies, but also if they're feeling sick, they have a little low-grade fever, to stay home and give the doctor's office a call if it's going on for more than 3 to 4 days, or if you're having trouble, tolerating fluids.
I want to talk about the flu for just a moment. You said going on a little bit longer than we typically see it. Yeah. Are we at this point even still giving flu shots? Is it traditionally just so late in the season, or is this something if someone really felt like maybe they were immunocompromised, they didn't get one already, kind of skirted through flu season, would this still be something they should get?
You could, if it's available.
Okay.
That's the other thing. A lot of outlets are just, they're out of the flu shot, which is why we always say, hey, once they're available, and that's typically in August, September, get the flu shot right then. Because those flu shots, we find, do not wane as far as their efficacy. They will continue through an entire year. And we see flu year-round. I've diagnosed patients with the flu in July and August.
Wow.
Yeah, so if you can get a flu shot and you haven't had one, you want to get one? Yeah, sure. It can't hurt. But at this point, it's not so prevalent that I think people have to rush out to get it. Like I would really encourage them to do so in August or September. As far as COVID, Arkansas has definitely seen, thank goodness, a big drop in those COVID cases. And the COVID that we see, even when we were seeing it, for most people, it's a milder illness, for the young and for the healthy. But if you're immunosuppressed, immunocompromised, if you're over the age of 65, diabetes, respiratory illnesses, those kind of things, then you have to keep your distance, and you have to, when you do get ill, stay home. Unless it's going on for more than a few days or you get a high fever, then call your doctor's office.
All right, well, call your doctor's office if it's something that concerns you. And you can also call them to talk about allergy immunotherapy shots, something that is becoming more and more popular. And yes, the doctor's office is doing that these days. So ask your doctor questions. And remember, we talked about this earlier. Tell them about your family history. Get those regular checkups. Go to baptist-health.com for more resources.